Our heart is a big pumping muscle in the middle of our chest, constantly sending blood circulating throughout the body to enrich us with oxygen and to acquire oxygen from the lungs. This back and forth push and pull, filling and depleting, has a natural rhythm that we can detect at any time. Blood flow which is slowed or obstructed can cause cardiac deficiencies, which is bad news, but can also be treated, which is good news, with medications, angioplasty, stenting, balloons in the veins to clear blockage, or by bypass surgery, rerouting the blood flow by grafting healthy veins acquired from the legs. What if there has been a heart attack, myocardial infarction, i.e. an MI? An MI results in heart tissue death, which is permanent because of inadequate oxygen supply. But like a stroke, the damage can be minimal. Some people don't even know they've had one, or very significant, causing lasting damage. After a heart attack, it's not unusual for the individual to develop an anxiety disorder. The symptoms of a panic attack are strikingly similar: shortness of breath, chest pain, sweating, dizziness. Unfortunately, cardiologists often ignore non-cardiac symptoms and fail to refer their patients for appropriate treatment. But if you have panic attacks, treatment from a psychologist or a psychiatrist can help establish disability for that condition if it does not improve despite treatment. Sometimes the heart is also defective and cannot maintain a normal or consistent rhythm. A pacemaker, which is an electronic device that jumpstarts the heart, is usually curative, but not always. When arrhythmias persist and occur 3 times a year, despite treatment, Social Security will find the condition disabling. Sometimes the heart is weak and are not otherwise amenable to long-lasting treatment. Social Security will evaluate the effectiveness of treatment when considering whether the heart is too damaged and results in disability. In 2008, Social Security added a new criteria, finding disability for individuals who have had 3 revascularizations, angioplasty, or bypass in a year. The heart relies on veins to carry the oxygen-rich and oxygen-poor blood back and forth. The hardest working veins are those which have to take the oxygen-poor blood from our legs and our feet back up to the heart, working against gravity. Conditions like chronic venous insufficiency or peripheral arterial disease can result and are considered by Social Security as cardiac disorders. These conditions can be found disabling when swelling is extensive, causing skin breakdown or cramp-like pains, often mistaken for peripheral neuropathy caused by diabetes. A Doppler study can effectively measure the severity of these symptoms, called claudication.